A few long months after COVID-19 first overtook the world, researchers announced the development of a vaccine. And the first COVID-19 vaccines were shipped and administered around the world before 2020, or what we now know as the worst year ever, drew to a close. But for many folks, news of a vaccine isn't quite cause for celebration. In fact, the news of a vaccine for many Black folks feels like trading in one health concern for another. This not so new concern being, how is systemic racism going to victimize me now? Bearing in mind the ways historical and ongoing medical mistreatment wreaks havoc for the health of Black communities, should Black folks get COVID vaccinated? Let's get into it. Before I do, don't forget to like and subscribe. A lot of us don't need to be convinced. We know COVID is no joke, and the latest statistics make that clear. When I researched this video in December, the number of global COVID cases had surpassed 79 million people, and the number of deaths had reached over 1.7 million worldwide. In Canada, over 535,000 people had COVID, and over 14,000 people died from the disease. For some perspective, the third leading cause of death in Canada in 2019, which was accidents, led to over 13,000 deaths, which could make COVID the third leading cause of death for Canadians last year, behind heart disease and cancer, and more than double the number of people who died from the flu in 2019. Remember when people were saying COVID was less lethal than the flu and not to worry, and Global News published this? So of course, the coronavirus is serious. So how are Black and other racialized communities faring amid all of this? Well, Canada doesn't like to collect race-based data. This was true of police killings and harassment until recent years, thanks to the tireless work of community organizers and advocates. And this is true of COVID rates. So we don't have a complete picture. Still, a few cities, including Ottawa and Toronto, decided to do it anyway. And the numbers are pretty grim. According to a report released by the City of Toronto, people of color are disproportionately affected by COVID. Surprise, surprise. People of color accounted for 83% of COVID cases, while only making up half of Toronto's population. Of these cases, Black folks accounted for 20% of COVID cases, while comprising just 9% of the total population, just lower than the number of cases reported by white Canadians, who make up half of the population. Also, Black Canadians are nearly 3 times as likely to report knowing someone who has died as a result of the coronavirus. Meaning, if you are not white or East Asian, your chances of getting COVID are far, far greater. Also, the lower a person's income, the data also reports, the higher the rates of COVID. So lower income communities are also disproportionately affected by COVID. And this is a trend seen in the US and the UK and across Canada, including Ottawa, where Ottawa Public Health found that 66% of people of color tested positive for COVID-19. What does this mean? Does this mean that Black and other racialized communities are just biologically vulnerable to this disease? No. Not at all. What we can see from the data and what we understand about how the coronavirus travels from person to person is that the issue is systemic racism. So let's start with how the virus spreads from person to person. The latest research finds that COVID-19 doesn't spread as often as we initially thought on contaminated surfaces. The virus, according to scientists, spreads mostly through inhaling infected droplets. So a person is most likely to get COVID by either being in close contact with a person who has the coronavirus, where you are close enough to inhale droplets, or by airborne aerosol droplets, which can linger for longer periods in the air, especially in poorly ventilated spaces where air isn't moving out and is inhaled. So crowded spaces, including restaurants, offices, and other workplaces, or circumstances where you are in close contact with a lot of people, say in arenas, or at crowded events and gatherings, make you most vulnerable to contracting COVID-19. Quick note, I'm not making the case for putting an end to washing your hands regularly or keeping hand sanitizer with you at all times or whenever possible. As we know, germs spread easily through infected surfaces and touch, and seasonal infections like the flu are still as much a concern as they've always been, even though that concern may be low. Plus, the information we get about COVID and what scientists are learning about the virus continues to evolve. So stay safe and keep washing those hands, using hand sanitizers in the absence of soap and water, and use every precaution available to you to protect yourself from this virus. So back to how systemic racism increases a person of color's chances of contracting COVID-19. Knowing what we know about the spread of COVID, it seems that to steer clear of this virus, you need to be able to do the following. Limit your interactions with people. Stay home. Work from home. Distance within your home. Have access to private transportation, or have access to quality air filtration in your home or work. What groups are more likely to do or have any of the following? People who work in jobs that can be done from home. People with job security and benefits, which include paid sick leave or leaves of absence. People with more square footage in which to live and distance within their home, should a family member get sick or come into contact with someone who may have been exposed to COVID. Or they perhaps have multiple homes, for example, cottages, where they can leave dense urban areas like cities and wait out the pandemic. People who own cars and don't have to use these cars to transport the general public, like say Uber drivers. People that work in an environment that is properly maintained and ensures the safety of their staff. Here's the thing. Systemic racism doesn't just shape the daily experiences of Black folks and other non-white folks for that matter, it shapes our lives. So what that means for racialized communities in Canada and the US, though this isn't an issue specific to Canada and the United States, is that racialized communities are consistently subject to unequal and limited access to opportunities, resources, and agency. These historical and ongoing inequities have led to growing economic disparities and socially isolated communities. And it's these growing disparities produced by things like the types of jobs a person can access, the wages they earn, the country a person immigrates from or lives in, the status of their immigration status, the color of their skin, their gender, and even the neighborhood they live in, which serve to disadvantage communities of color before and through this pandemic. Systemic racism is families of color living in poverty at 3 times the rate of non-racialized families. Systemic racism is people of color accounting for 21% of Canadians living in low income to 12% of non-racialized people. Systemic racism is 1/5 of all employed Black Canadians and nearly 1/4 of all employed Filipino Canadians working in the healthcare and social assistance industries, while Black employees earn $23 and Filipino employees earn $26 to the $30 per hour paid to people who are not racialized in this same industry. Systemic racism is also the concentration of new Canadians and families of color into high-density neighborhoods where socioeconomic statuses are low and housing stock consists of less single-family and detached houses for more apartment buildings, row houses, and other forms of housing that tend to be small and in close proximity to each other. Over 3 million Canadians lost their jobs as a result of the coronavirus, and about 1 million others now work from home. But the ones who continue their work as usual, our essential workers, ensure that the rest of us can exercise some level of precautionary distancing and ensure that our economy, while in a nosedive, does not come to a complete crash. These industries also mean that workers who occupy these roles often face a greater risk of contracting COVID. What we've seen through this pandemic is that doctors and nurses aren't the only people necessary for us all to make it through this pandemic. People who process and pack our foods in cramped, unsafe factories, teachers, people who make and serve our food in restaurants, retail staff, personal support workers in long-term care homes, the people caring for our seniors, nurses' aides and orderlies, shelter workers. All of these people play a role in keeping society functioning. Yes, it's dysfunctional, but it's not their fault. That's a whole other video. While we've relied on essential workers to make it through the pandemic, here's what's not discussed enough about many #COVID heroes. These positions are often precarious, low paying, lacking benefits like paid sick leave so a person can stay home from work if they may be experiencing COVID symptoms, dangerous even under normal circumstances, and they're disproportionately occupied by Black and Latinx people and immigrant workers. And here's what the data tells us. 34% of essential service workers are racialized, compared with 21% in other sectors. People of color are also more likely to work in industries most affected by the pandemic. So if racialized populations, particularly Black folks, are impacted by COVID at higher rates, then Black folks should get vaccinated, right? This can be a complicated question. Let me explain. A recent survey found that nearly half of Canadians said that they would get vaccinated as soon as the vaccine became available to them, while 14% of Canadians in the survey said that they wouldn't get vaccinated at all. So vaccine hesitancy seems to be pretty common among Canadians, at least according to this study and my Facebook feed. Most people in the study who said that they wouldn't get vaccinated immediately reported being concerned about possible long-term effects of the vaccine, and others said that they were concerned about the speed by which the vaccine was developed. But for a lot of Black folks, the question of whether or not to get vaccinated isn't just about the development speed or the side effects of this particular vaccine. It's about trusting a system by which we've been targeted for literally hundreds of years to deliver on the promise of quality care and safety, when that same promise had been made and broken many times over, costing racialized people in Canada, particularly Black, Indigenous, and Latinx people, their lives. Remember, these were abuses that the general public weren't intended to know was happening. It had only been through the efforts and testimony of citizens, whistleblowers, advocates, organizations, through Freedom of Information requests, which grants access to records and other types of information, that these vile acts became public record. These medical abuses, some committed in the name of science and research, all carried out by officials who had a responsibility to protect the public, including those harmed, all lend itself to the valid concerns many racialized groups have about entrusting their health to government agencies. And that doesn't even cover how discrimination and racism in the healthcare system today contributes to poorer health outcomes for racialized communities, particularly Black, Latinx, and Indigenous communities. A number of studies have found that healthcare providers possess an implicit bias against some racialized groups, which impacts the types of care Black, Indigenous, and Latinx people can access, and can sometimes mean the difference between life and death. This point is confirmed way too often in Canada and abroad, and it was most recently seen in the case of family physician Dr. Susan Moore. 2 weeks after posting a video to Facebook accounting her experiences at an Indianapolis hospital, where she said she was made to feel like a drug addict for requesting pain medication and detailed the ways she had been mistreated by the doctor attending to her, she died. Dr. Susan Moore's video is a heartbreaking testament to the kinds of treatment people of color are subject to through normal times and continues through this pandemic. In the video, Dr. Moore is seen laying in her hospital bed, suffering with COVID, hooked up to an oxygen tube, and her voice breaking as she explained her ordeal. If a doctor can't receive the quality care to which she is entitled, if a doctor can't advocate for her right to respect and to be heard because she's Black, what do you think that means for the rest of us? In her video, Dr. Susan Moore declared, "I put forth and I maintain, if I was white, I wouldn't have to go through that." And according to the vast body of research, she may be right. Several studies confirm racial differences in access to quality care and treatment in the medical industry, which has led to higher mortality rates for people of color. Racial differences informed things like who receives cancer diagnostics, for example, and resultant care, a disease physicians have had a lot longer time recognizing symptoms and treating than COVID. The book Unequal Treatment: Confronting Racial and Ethnic Disparities in Healthcare notes, evidence suggests that disparities in cancer care are associated with higher death rates among minorities. For APA.org, Tori DeAnglis writes, unequal treatment concluded that even when access to care barriers such as insurance and family income were controlled for, racial and ethnic minorities received worse health care than non-minorities, and that both explicit and implicit bias played potential roles. And these biases are baked into various technological tools used to provide care, which ironically were created to mediate such biases. And these are even found in how we evaluate symptoms. For example, one of the symptoms listed on the CDC's coronavirus symptom checker, currently on their website under when to seek medical care immediately, is bluish lips or face, which is kind of hard to evaluate on darker pigments. Evaluating symptoms as they present on Black bodies is so not commonplace that a 20-year-old Black medical student had to publish his own book on how to diagnose patients with darker complexions last year. So should Black folks get vaccinated? According to health professionals, many of them also Black, absolutely. But health providers and officials also have a responsibility to better serve Black communities by meeting our health needs and hearing out our concerns, particularly through this pandemic. Because many people of color aren't just merely anti-vaxxers or misinformed. Many of us are keenly aware of the ways in which the medical community undermines our needs. As epidemiologist Dr. Kamara Phyllis-Jones has said, race doesn't put you at higher risk. Racism puts you at higher risk. What health providers, policymakers, government officials, and science and health communicators can do to address these concerns is to acknowledge the long history of systemic racism perpetuated by the medical and science communities, which have caused immeasurable harms to Black, Latinx, and Indigenous groups, not only in the past, but continues in our present. We find ourselves in strange times when getting vaccinated can feel like taking a leap of faith, especially when we know that vaccinations have helped to eradicate deadly diseases in the past. But it would be a huge mistake on the part of health providers and our governments to continue to ignore vulnerable communities and not actively work to repair trust and ensure transparency. And that doesn't end once every person who wants a vaccine receives it. And that work to ensure trust doesn't just look like better communications or access to vaccination sites or prioritized and targeted care. It also looks like putting policies in place to protect the people on the front lines. Our frontline workers, remember them? The largely racialized folks streamed into these underpaid, physically and emotionally taxing and undervalued jobs. They didn't need us standing on our balconies clapping. They need employment security. They need full job benefits. They need wages they can live on. And especially now, they need paid sick leave, to which a significant number of people in the care and service industries don't have access. In fact, only about 10% of low-wage and frontline workers in Ontario actually do. Quick note for everyone else, while we can't pay frontline workers, we can certainly advocate for their right to higher wages. You can vote out officials who have shown that they're actually pretty indifferent to the needs and work of the people who make this pandemic suck less. If that's too much work, we can also leave them the hell alone. Frontline workers are on the front lines of enforcing public health provisions in businesses. They risk their well-being providing critical services through a global pandemic, which is far above their pay grade, as we've established, and they're enduring the worst of anti-mask rage and hostilities. PSA: frontline workers are not your punching bags. Channel that energy into a nice letter to Doug Ford or Jason Kenney for you Albertans. Leave frontline workers alone. Anyway, for those of you still unsure, researchers ensure that both the Pfizer and the Moderna vaccine have gone through all of the testing and trials required of a safe vaccine, and they've released reports detailing the development process. Both reports include the background of clinical trial participants, which indicates that 10% of people used in the clinical trial for both the Pfizer and Moderna vaccines were Black. I've included links to both reports, which you can read in full in the description below. To those of you still concerned about receiving a vaccine, particularly if you're Black, I understand, and it's not your fault. But please do yourself a favor and your loved ones a favor and talk to your family doctor or a doctor you trust about your options and have them address any questions or concerns you may have about protecting yourself against COVID-19. Thanks for watching until the end. If you've enjoyed this video, please like and subscribe. I'm making these videos to help inform and dialogue, so if you have any questions, comments, or suggestions for future videos, please comment below. Thanks again. Bye.